Greetings to you all. My name is Dr. Live Zambezi. Today, I will be talking about the effects of diabetes on your eyes. So, I will be answering some questions.
Question number one. How would a diabetic know that their eyes are affected?
Thank you very much for that question. So, the symptoms of diabetes, diabetes effect on the eyes include poor night vision, blurry vision, distorted images, fading of colors. You may start seeing fading of colors, and also eventually it may lead to total blindness. So this is how one knows that the eyes have been affected by diabetes.
Question number two. How does diabetes affect the eyes?
So as you all know, diabetes is a condition characterized by high levels of glucose in the blood. So if there is prolonged or chronic high levels of blood sugars which are poorly controlled, it will lead to formation of some substances. These substances will affect your small blood vessels, which are called capillaries. These small blood vessels are affected, it leads to fluid leakage into the retina. The retina is the part of the eye which is responsible for vision, for seeing. It is at the back of the eye. So there's leakage of fluid into that retina. These are the initial stages. Then when there's leakage of fluid in the retina, then you start experiencing blurry vision or poor night vision, those symptoms which I mentioned earlier on. Then when this continues, when the leakage continues, the swelling continues, then it will lead to ischemia, that is compromised blood supply to the retina, because there's swelling, there's so much swelling, so there will be reduced blood supply to the retina. This will now lead to formation of new vessels, vessels which are these vessels are fragile. Then they will start again to bleed into the eye, uh, further worsening the your vision, the loss of vision loss, and may lead to total blindness.
Question number three. What is a diabetic supposed to do to make sure they have healthy eyes?
So, as I mentioned above, that the effects are in stages. One, we need to make sure that the blood sugars are well controlled. Make sure that your blood sugars are well controlled, because for us to get into all what I described above, is all starts with poorly controlled levels of blood sugar. So if uh, the levels of blood sugar are controlled, then we will not have these processes happening to you. Then we also need to make sure that screening is done. Every diabetic patient should have their eyes checked on diagnosis. Once you are diagnosed of diabetes, make sure that your eyes are checked by an ophthalmologist. And also, every year, you should make sure that your eyes are checked. So that the importance of screening is that if the you are screened early, will there will be a solution to the problem which we are having. Because remember the stages which I mentioned. Let's say it's still in the early stages where there's just mild swelling or a mild leakage of fluid into your retina. Then you can be given something to stop that, or to slow the process. And also, whatever stage which has been which you have been screened at, it also helps uh, to be treated early before there is total blindness, because it's so difficult now when the vision has been permanently lost to be restored. So screening helps because when you are being screened, sometimes you don't even have symptoms. So it helps to treat to be so that you are treated early, and that it does not progress to total blindness. Um, Thank you very much for your questions. Uh, I hope this was helpful, and we'll be able to address other questions which will be coming through as we go. Thank you very much.